Hello, today we are going to interpret the small intestinal bacterial overgrowth breath test. Our first case is a 29-year-old female who has horrible bloating all day long. This all started 2 years ago after 2 rounds of antibiotics. She has seen several practitioners for these issues and has been on 3 botanical antimicrobial protocols that have worked temporarily. She eats an autoimmune or paleo-type diet that is low in FODMAPs, which is an acronym for fermentable oligomonosaccharides and polyols. FODMAPs are short-chain carbohydrates that bacteria can ferment to produce gases and symptoms. She also tends towards constipation. Here's her SIBO test. We have a 3-hour test because of the constipation. The test is pretty unremarkable, so right away I'm not thinking that her GI issues are entirely due to SIBO. However, when a patient is highly symptomatic, but the test results look unremarkable, it's always a good idea to check with the patient to make sure they collected the samples properly. She has a negative result for the hydrogen at the bottom left. She has some methane present, and even though it was less than 10, a finding of 3 to 9 may be significant in a symptomatic patient. Constipation is associated with methane, and diarrhea is usually associated with hydrogen or hydrogen sulfide producing SIBO. That's not an absolute rule, but it is common to see that. If you look at the actual collection times in the middle of the page and compare it to the top of each column, you can see that she collected a bit off schedule. Generally, a few minutes is not going to make that big of a difference with the interpretation, and in her case, she was 8 minutes off on most collections. The hydrogen result is really the one that is time dependent, looking at samples 1 through 5, whereas the evaluation for methane is not time dependent. The calculation for evaluation for hydrogen is made by taking the highest hydrogen finding among S2 through S5 and subtracting the baseline. In her case, if you look at the chart in the middle of the page and look at the hydrogen row, you can see that the S2 sample was the highest at 7 parts per million, and if you subtract the baseline of 5, you get 2. There are a few different approaches to take with this patient. One would be to prescribe an antimicrobial regimen for the methane, since she tends towards constipation, which is generally associated with methane. She has not tried a prescription antibiotic in the past, only botanical regimens. The literature says that rifaximin with neomycin is effective for methane. I'm not leaning too strongly towards this option though, because her symptoms seem too extreme for the findings on the test. So when you see a test that doesn't look too remarkable, yet the patient is highly symptomatic, there are a few other things to take into consideration. One is that they might be producing a lot of hydrogen sulfide gas. Hydrogen gets consumed by the bacteria that produce hydrogen sulfide, so you might see low hydrogen on our test, and there's not enough hydrogen available to make methane. A sign of hydrogen sulfide overgrowth is flatulence that has a rotten egg smell. Studies show that hydrogen sulfide is more associated with diarrhea versus constipation, and there's not a lot published about hydrogen sulfide treatment. Another consideration with this patient is fungal overgrowth. She can do stool testing to see if there's any yeast. If there is fungal overgrowth in the small intestine, there wouldn't be a way to test for that other than doing endoscopy. I would be interested in seeing if there are other things that could be contributing to her symptoms, and a GI Effects Stool profile can reveal other organisms like yeast or parasites, as well as digestion and malabsorption markers and inflammatory markers that might give more insight. I would also make sure her bowels are moving regularly every day, so I would support her with magnesium or a supplement that's designed to promote motility. Generally, people with SIBO respond to a low FODMAPs diet, so since she's already doing that and is still highly symptomatic, then I'm thinking something else is going on. The second case is about a 76-year-old man who has lots of digestive symptoms, including diarrhea, abdominal pain, excessive gas, and dyspepsia. He takes an over-the-counter proton pump inhibitor for the dyspepsia. He's retired and likes to eat out a lot. He smokes 1 to 2 cigarettes daily after meals and has 2 to 4 alcoholic beverages per day for happy hour. He takes walks with his wife and dogs, and he had a screening colonoscopy every 10 years, and they've all been negative so far. The first test that was run was a GI Effects Comprehensive Stool analysis, and there were a few abnormalities as well as some markers that suggested SIBO, so he also completed a SIBO breath test. His results were strongly positive for both hydrogen and methane, as you can see in the boxes at the bottom of the page. In his case, we see an elevated baseline. If you look at the chart in the middle of the page, the first column shows the baseline reading. The baseline sample is collected before they even drink the lactulose, so the expectation is that it would be low. When the baseline is elevated, it could mean that they didn't follow the collection instructions properly. There's a prep diet that they should follow that eliminates any foods that would feed bacteria. So if he ate a lot of fiber for dinner last night, this elevated baseline could be the large intestine bacteria still fermenting it from the night before. Also, smoking can elevate hydrogen levels, so it's important not to smoke before or during the test. There are other instructions also, like avoiding toothpaste, so make sure patients are very clear on following these instructions. There's a link to the collection video on the SIBO homepage on our website. It is common to see an elevated baseline with methane, and generally there's not as sharp an increase in methane throughout the test like we might see with hydrogen. So in this patient's example, we see in the line graph at the top a straight line for methane all throughout the test. This is a typical methane pattern and can be clinically significant. With hydrogen, an elevated baseline usually means they did not follow the collection instructions properly. If they did follow the instructions properly, clinical significance of a hydrogen that's elevated on baseline is not known. In this patient, we see an upslope in hydrogen as the lactulose is transiting through his small intestine. Even though the baseline is elevated, we see a sharp rise in hydrogen beginning between the S4 and S5 sample. If you take the highest hydrogen finding between S1 to S5, we see that S5 was the highest at 78. If you subtract the baseline finding of 25, you get 53, and that is the number in the results box at the bottom. I always check the actual collection times box to make sure the patient collected on schedule, and in this case, if you compare to the suggested times at the top of the column, you can see that he did follow the schedule. After the patient completed the SIBO test, he implemented some treatments recommended from the GI Effects Stool results. His pancreatic elastase was low on the GI effects, so it was recommended that he take pancreatic enzymes with meals. Aging is associated with decreased pancreatic elastase and hypochlorhydria. Some clinicians may give a broad-spectrum digestive supplement that would include enzymes, hydrochloric acid, and bile acids to help overall digestion. Hypochlorhydria can be associated with dyspepsia as well as SIBO. It would seem counterintuitive to give hydrochloric acid while weaning off a PPI, so in his case, we might just see if the other recommendations make a big enough difference in his symptoms first. It was also recommended that he decrease his alcohol intake. Low pancreatic elastase can be associated with alcohol intake. Also, people with reflux and dyspepsia should avoid alcohol because of the multiple physiologic mechanisms that can exacerbate the condition. With the strong positive results of the breath test, it was recommended to treat the SIBO with rifaximin plus neomycin, since this combination addresses both the hydrogen and the methane. Another consideration would be to use rifaximin for the hydrogen and high-dose allicin, which is a compound from garlic, to treat the methane. He also had yeast on his stool test that was sensitive to garlic. Once he completes his antibiotic course, he should take a follow-up SIBO test within 1 to 2 days. If the SIBO is not eradicated, we might consider another round of antibiotics or switch to a botanical regimen. If the SIBO has been eradicated, we want to focus on preventing a recurrence. We would have him take a motility agent before bed to help the migrating motor complex, which cleans the bacteria out of the small intestine. Iberogast might be a nice consideration for this patient. It's an herbal formula that improves motility and can help dyspepsia as well. We would also recommend a low FODMAPs diet. A GI repair protocol is also a good idea because SIBO can be associated with a lot of damage to the small intestinal lining, and alcohol can increase intestinal permeability. This would include nutrients like glutamine and zinc. Feel free to contact client services with additional questions or if you need assistance setting up a MyGDX account. We also offer complimentary appointments with our medical education specialists. They can answer questions related to our testing, including choosing the right test for your patient and reviewing patient test results. We look forward to hearing from you.